Hello, good evening. I am Madhu S. Rao, psychologist, author, counselor, and a mental wellness coach. Today, a very warm welcome to all of you on this session, Early Signs That Parents Should Not Miss. We will be talking about some of the signs related to autism, ADHD, and dyslexia. The purpose of this session is to bring out those symptoms that parents can observe in their children and take necessary help at the right moment. So, this is not going to be a diagnosis or a session where we will be talking in depth about what is autism, what is ADHD, or what dyslexia is about. I will try to hint here and there in the course of discussion, but there's a lot of parameters that we check when we have to diagnose this. But what we will try to understand is primarily some of those symptoms which are obviously seen, which we cannot ignore or which we cannot miss out in our day to day life. So let's go into this session and we will look into what are the different things and what are the different symptoms. Like I said, this is not going to be for a diagnosis purpose. This is only going to be an awareness session. But before we go into that, there are certain things every parent knows. And I wish we just revise that, take those basic points before we go into this entire session of understanding. What are those? We all know that every child is unique. They all have their own development life cycle. They have their own unique characteristics and personalities, right? So, children develop at their own different speeds or pace. Do not compare. If you observe differences, do not call them as deficiencies. They are their uniqueness. Like we said, every child is unique. So, the differences that you find between two different children or when you compare with their age group, do not label that as deficiencies or shortcomings. They are basically nothing but their uniqueness. The third most important thing is every child has one particular stage that they will need help, and this can depend upon the child. Some of them may need it early, some of them may need it later, some of them may need a continuous support until they grow big and mature and take decisions. So, with the assumption and with the knowledge that every child is going to be unique, they have differences, and they will also need support at different points in life. Well, this brings us to a conclusion that the same parenting style will not be applicable to more than one child. The parenting style should also be customized to that particular child. Right? Let's go. With one sign, we always do not say that don't label the child. Please do not give a label to the child or brand it that this child is dull, this child is shy, this child is very bold, or it's very introvert, or even for that matter, the child does not open up in front of others but does well at home. These are the uniqueness. So we need to identify the strengths, weaknesses, and accordingly train them, mentor them, and give them an environment where they will grow much more comfortably and in a healthy way. So, having said that, all of us have experienced that when a child is born, we regularly visit the pediatrician to check its progress. How is the child growing? So normally the pediatrician would measure the head circumference, look at the bones, look at the joints, the movements, the vision, the hearing. and then also whether it's speaking or not speaking, uttering words, response. All these things are physical attributes that somebody checks. So, how is it different in psychology? When it comes to mental health, we look at a few parameters that plays an important role in the growth of a child. The first thing that we look at is talking and language. Not necessarily in the same order. This can be in any order depending on the age and for what reason we are looking into this. But primarily these are the areas that we look into: talking and language. Now, when we speak of talking, it's all about how well they pronounce. Are they clear? The vocal cord vibrations, the tongue twisters, do they know how to control the breath? All these things come into picture when we are saying about talking. Do they make sense? Are they comprehending and then speaking? Language. Language is primarily picked up from the environment. Remember that the children are a clean slate. So the language that they hear, they respond, they pick up, they start speaking, they start uttering words. All these things are from the environment. In a moment, as we go into this session, you will understand why is this so very important. Attention and activity. Now, this is more about focus, an urge to take an action and complete the action. So this is where your cognitive processes comes into picture. Is the child able to pay attention? What is the span of attention? How long can this child focus? Is the child melting down pretty quickly? Or is he or she able to maintain a constant focus over a period of time? It could be in some areas, probably in some subjects, or it could be in art, drawing. But when it comes to some other subjects, probably they are not able to pay that much of attention. Attention and activity gives us a parameter of how the child is processing the information and producing an output. Again, this will vary at different ages. Third is the social connection. The social connection, what we call, the psychological term is called the social cognizance. Why is this very important? This is very important because the way an individual relates to another individual, understands their communication, participates, collaborates, or has fun, and works in a team, lives in a team, or lives among a group of people. All these things are social connection. For instance, if a visitor comes home, is the child shy in nature and hesitates to say hi, hello, a welcome message? Or does the child very, very openly start talking to the people or the visitors anything and then anything that they want? So the social connection plays a very important role as the child grows because there is a certain age when they will start something called as the identity formation. The identity formation is an important phase of life where they identify themselves among certain group of children, among certain uh, groups which has an elite function or a specific interest. Learning and memory. Now remember, talking, language, learning and memory sometimes is used very, very nominally or casually, I would say, where parents consider language, learning, memory, or talking, all these things as a part of your learning process. They are actually two different things. Talking and language certainly attributes to the environment, but when it comes to learning, please remember there is something called the cognitive process. Is the child able to understand? Does the child understand things and then comprehend it, makes sense out of it, and then reproduce that in a very, very legible form? Or is the child only able to understand in a specific format? And if so, can it reproduce what it understood? Can it write? Can it say? Can it express? So learning is different. Same thing with memory. There's always a short-term memory and a long-term memory. Again, the memory is divided into four different things. I would not go into that depth here in this session, but a short-term memory and a long-term memory. The moment you explain something to the child, right, the child feels, oh, yes, I understood this. But half an hour later, you come and ask it to repeat, the child is probably confused or it partially reproduces that. Now, this could be related to your attention and activity, or it could also be related to talking, language, comprehending skills. So learning and memory is another area that we always consider. And do remember that when we are talking of autism, ADHD or dyslexia, these five areas play a very, very important role. Emotions and behavior. Is the child able to express itself? Does a child feel comfortable in stressful situations? How does the child react to a stressful situation? How does the child react basically to an very interesting or over exaggerated situation? So, when you think of these things, right, the emotion is a language that every human being communicates with, resonates with. When I am able to understand your emotion and I communicate in the right way, my behavior is also perceived in that right way. So emotions also triggers behaviors. So this is one of the reasons we will understand in ADHD when we say either the child is very hyper, and is the hyper because of the emotion or because of not being able to vent out what it wants to say. So these are the primary five areas. Apart from these, there is also a lot. We look at the environmental factors, the influencing factors, distractions that is coming in, lifestyle factors, parenting style, sibling rivalries or sibling positions, peer pressures, the institutional systems that it is coming in. Is it a nuclear family? Is it a joint family? There's a whole lot of parameters that comes into picture. But when we talk about these five things, they give us a clue where else to look for any kind of a symptoms or the cause for the symptoms. Having said this, a very important question comes now. I said in the beginning that what the early signs, parents should not ignore the early signs. Now, what is this early sign? Is it the first sign that you see? Is it the first time you see a symptom? What we generally refer to as when we have to do a diagnosis, or after this session, when you go back, I request you to look at this as a pattern. Now, what does a pattern mean? Let me give you an example. Until last year, the child was enjoying the school. But of late, I have seen that, in the last 1 week, 10 days, whenever the child comes back from the school, the child is very stressed out. It does not want to talk. The child does not want to share what's happening in the school. Or the child is kind of lost and child wants to take a break. Child never wants to get back to studies. If this happens for 5 days, 10 days, then it's kind of okay. We can talk. You can try to find out what's happening, deal with it, give it certain solutions. But if it's happening more than a month or two, then there is a need for you to consult someone who is an expert to go beneath what you can see and find out what is happening within the child. Now, this becomes a pattern if it continues for more than a month. Then the pattern starts repeating itself before it becomes a habit, before it becomes a personality type. it is always good to get some recommendations or solutions from an expert. Now, how is this kind of expressed? Right. It could be in the behavioral form, but what are the things that we need to observe? They can show up as areas where the child is not able to understand. It could be emotion, it could be rules and regulations, it could be certain procedures, it could be the subject itself, it could be the language, or it could be anything that it has no clue of why and what. When it starts losing a logical sense of reasoning, then there is something that is bothering it beneath. Difficulty focusing. If a child is not able to focus, then it is not just the lack of interest. Well, it could also be lack of understanding, or it could be lack of reproducing that, right? I don't understand what this is and I don't understand how to do this. So basically, I don't know what I am doing, and hence the child loses its focus. Difficulty in expressing. This is not just about what the child is feeling or what the child is going through. Even if there is a question and the child is not able to express its thoughts, if the child has understood a subject, a point you might have explained after reading a paragraph, but the child is not able to express it in its own words. If the child is not able to express what happened today, the entire day, and how it is feeling now, then it is something that we need to start addressing, because if this persists for a longer time, then probably the child may get into a depression or a silo mode. Means it starts feeling lonely and it starts separating itself from the group. So these are the three areas where you can actually look at how the child probably will express this, and please follow for the patterns. If it is a one-time behavior, it is a signal. If it is a pattern, then it definitely is developing into something much larger, and we need to catch that before it becomes a personality, a trait, or a disadvantage for the children to progress. So early signs are only signals, they are not problems. The child is always trying to do its best. Remember, every child tries to give its best. But when they are not able to give it, that means there is something bothering them or something that is not working in favor of them. And that is the reason they are a little confused how to go about doing this. When we go to the root cause of that, we will be able to identify that. So early signs are only signals and they are not really problems. We shall go into and see what these symptoms are. For each of them, let's look at them. We'll start with autism. So, what is autism? You might have heard a lot about ASD, Autism Spectrum Disorder. Autism basically is nothing but a child is not able to relate with another person, another child, could be parents, it could be peers, in the friends, or it could not be able to relate itself to the environment it is. Let's put it simply. Autism is nothing where a child has its own world, and this child prefers to live in that world because the outside world is not making any sense for this child. It doesn't know what is happening. And hence the child prefers to continue staying in the same world. It does not put any effort to understand the external world or the world we all live in. And these are some of the basic signals or signs that you can observe. Before I show you what are these signs, let me tell you, or probably let's also caution ourselves that these are not the only signals or the signs that you have to watch. Because when you come for a clinical diagnosis, there are more than 20 to 25 parameters on which we check the child. Could be on behavioral issues, it could be on emotional resilience, it could be on gross motor skills, fine motor skills. There is a lot of things that we go through, diagnose, and then say which part of autism spectrum disorder is this child. Is it in the early stages? Is it into little advanced developed stage? Or is it in a very advanced stage where the child needs a lot of help? Without that kind of a help, the child will not be able to do this. These are some of the things that I urge the parents to have a keen eye on, keep observing, and whenever you find this, first time, second time, third time, and when you think it's becoming a pattern over a month, probably even 15 days, 20 days, talk to an expert like a psychologist, a counselor, a special education needs, or it could be a special educator also. Anywhere you find around, talk to them, get to know what is bothering them, and that will help you assess whether the child is developing normally or is there some help that the child needs. This starts as early as 12 months or even 9 months. When the baby is 9, if the child does not start responding to their name, if the child has no clue that my name is being called, they are not responding, then that's a first sign that you can pick up that there is something. But don't panic, huh? Don't panic. This normally children take some time to develop a response system. They may not be able to focus from where you're calling. They will take some time to respond, build that personality or character within them. Wait for some time. Usually, the children will start responding anywhere between 6 to 9 months, and at least if you say first year, they should be able to recognize their name and respond when called. In case they are not, then it has already become a pattern and you need to really consult someone. Most of the time, I've heard parents saying, my child is a bliss, it's a blessing, they are in their own world, they like to play by themselves, they are up to themselves, and they don't really bother much, they don't trouble me. Well and good if they're doing so on a normal routine and a normal scale, but if they're also performing well on the other sides like studies, behavior, lifestyle, cognition, all these processes, then this is something that you can tweak or adjust as a behavioral pattern. However, if you find this also affecting the other parts like studies, food, getting organized, or not able to understand the instructions, or if their routine is changing, then these are all certain symptoms of autism. Try to engage the child, try to allow it to mingle with others, and if still not happening, then please take this as an observation. See if a pattern is repeating, and if that pattern is repeating, it is advisable to always consult and get help at the right time. This is a very, very prominent one. They find it very difficult to have an eye contact and talk. If the child is not having an eye contact whenever you're talking or whenever somebody is talking to them, they keep looking around left, right, top, bottom, here and there, and then they try to they repeat the same words what they're talking. They sometimes talk what is in their mind without responding to what you're talking, or they again and again ask you the same question, or they keep uttering uh, mm. That means their cognition process is slower, and they are not able to make an eye contact with you. This is a very strong indication of autism. So even if you find this, try to sit at their eye level, talk to them, Try to establish an eye contact with them and slowly, calmly, with a slow pace, talk to them, because they generally understand instructions when it is spoken in a slow pace. The normal pace that we talk is very difficult for them to understand. Just imagine they are in a slow motion world and we are in a normal world. So anything from the normal world that is given to them is absorbed slowly, slowly, and slowly. Give them some time to respond. They will come back. If they can't come back, repeat it. So maintaining an eye contact when you do this, if they are able to do that, then it could be a maladapted behavior. Try to set it right. But if in case it is still not working, then this is repeating over a period of time and it's become a pattern. Again, please consult anyone who can help you out, like I said. If the child is very, very sensitive to, say, light, or if there is a loud noise, they get irritated. If there is a very dull lighting, that also could irritate. They could be irritated by seeing certain colors. For example, if their study table is facing the wall, or a drawing board that has a different color, probably that color is also irritating them. There could be certain textures. Uh, this probably would be seen in dresses and food items. Something like a liquidy, mashy thing, something like a jelly. They may not like these things. I'm not saying they exactly not these things. Some children may like jelly kind of a thing, some children may not like. The moment they see that, they might start becoming sensitive and they may start throwing tantrums. If that is the case, do not ignore that it is only one thing. Keep observing if the same texture kind of a thing is irritating them other places. Like, for example, let's say the teddy bear, which is soft. If that is kind of irritating them, if the same textured blanket is also irritating them, or if the same textured jacket is also irritating them, then they are developing a resistance to the texture. Children with autistic syndrome are very, very, very specific about what they want and what they don't want. They are not flexible in nature. That's why I said this is more about adaptation skills more than a deficiency in the child. So, forcing upon to them could only lead to two things. Either they will get very irritated, they will melt down and throw tantrums, or they would probably just absorb it, do it, but without appreciating it. And that could also lead to depressive characters. Eye contact and repetitive certain actions or routines. These are two things that you can profoundly see in autistic children, like probably beating the fingers, shaking the leg, or rubbing the table when they are studying. Or if you're teaching them, they might probably be holding the pen or pencil in their right hand, but the left hand would be constantly engaged with a sharpener, an eraser, or probably a scale. So some of these things where they have a repetitive action, but when they are playing or probably watching TV or walking with you in the park, they might not be using these repetitive actions. They could be using it only in certain places. So when this repetitive action is seen, that means they're finding it difficult. They are not able to follow it. And the way they express their frustration or irritation is by diverting it to these repetitive actions. Some of the children even bite the pencil or the pen cap when they're studying, they get irritated. So these are some of the things, and most often there are a few other symptoms which also I would like to share apart from this. Children would not like to change their routine. If there is a change in their routine, they get very irritated. If there is a change in their food style, they get irritated. If there is a change in the color patterns that they have, they could get irritated. They will not be having the patience to sit. and understand. They would not be having a span of attention and a focus. These are all some of the areas where the child needs a mechanism. It's not a deficiency. There is a separate method. The child has to be understood, given it a method, and once the child starts following that method, you will see that the child is able to sit and do things. But the problem is the method that we are used to or any other child is picking up is not something that this child is able to understand. And that is where the whole problem comes. So, in autism, especially in autism, ADHD or dyslexia, this slide is applicable for all of them. Most of the time, what we generally see where parents fail to catch these early signs is there is a catch 22. You are either thinking the child is too young and it will grow, and as it grows, this would probably get fixed. These problems will not persist. Well and good. But what if it does not? What if it develops into a major problem? Hence, as per psychology, we say there is something called an early intervention and a late intervention. What is an early intervention? The earliest intervention means we are catching it, diagnosing it, identifying the root cause, and trying to put a framework in place or a method in place so that the child will not have problems with growing normally. So, what is this earliest stage? The earliest stage starts as early as 1 year to 1.5 years. So, this is where the parents are pampering the child and considering it as a baby that is growing. But yes, certain parameters that the child has to attain by a certain age is not well understood. A pediatrician would definitely check the physical attributes, but how do you know if the child is able to speak? Is the child able to understand? Is the child able to respond? Is the child understanding the emotions? Is the child understanding what the meaning of a smile? And when you actually frown, what does it mean? So these are all some things that you can catch as early as this point. Within 3 years, any kind of an intervention is called the early intervention. Anything beyond 3 years, we call it a late intervention. So, what does a late intervention mean? It simply means that the child has either given up trying on that, or the child is still struggling a lot and showing lack of interest in that, or probably the child has got adapted a system for itself to deal with that. And that system may not be giving it results. It could be sufficient for the moment to escape a situation or get away from it. Simply saying, writing down notes, copying it from the board. How does it copy? It just copies it as it is. It does the child is not understanding, remembering few sentences and then copying it down. This method depletes over a period of time. This will not be applicable when the child reaches third standard or fourth standard because that stage the child is expected to comprehend, memorize, and then reproduce. So please understand the age 18 months or 1 year to probably 3 years is a critical phase where we can help the child without much difficulty adapt a method that will really enable the child rather than put it into a struggle. So do not ignore this phase and think the child will start adapting over a period of time. Having said that, autism can also lead to ADHD. Now, what is ADHD? It is generally used as a one term, but clinically, when you diagnose, you will see it as either attention deficit, that means there is less attention, hyperactive, or the child is very active, super active, hyperactive, or it could be attention deficit hyperactive. That means it could be a combination of three of these things. So generally, when the children are very, very hyper, you get to hear this term, the child has ADHD. The way to interpret this is the child has an attention deficit somewhere and hence it is becoming hyperactive somewhere else. So here is some symptoms that parents can understand or easily catch. The children find it very hard to sit in one place. They cannot pay attention. There is an irritation. There is some kind of a frustration, or it's like the bubbling gas of a soda can. It just wants to let that gas go out. The child wants to let that frustration go out. This could be in case of studies. This could be in case of eating. This could also be in a social setup, like you go to a birthday party, you go to a function, or you take the child to a mall or a temple. When the child starts getting irritated, they don't know how to express it, they don't know how to control their emotions, they don't know how to come and talk to you saying, I want something better than this. They start becoming restless. This is when you will find it hard to control them. These children, the span of attention would be less, or let's put it this way, that the focus that they will be able to put on anything is kind of less. Distractions are very, very easy. Let me put it in a simple example. Suppose you're teaching the child, you just explained a sentence, and the child is expected to write that sentence. In between the sentence, after two words, the child says, I want to drink water. You ask it to pursue, finish the sentence, and then you can drink. And immediately after another two words, the child may ask, Mama, what are you making for the dinner today? I'm feeling hungry. Or the child could suddenly start speaking about something random that happened in the school while you are expecting it to write something or study something or do some other activity. The lack of attention, the lack of focus is easily seen in these children when they start doing random things. They get distracted very easily. The other important symptom is they're very, very impulsive. The children do not think of the cause. Something comes to their mind, they just have to do it, and they do it. It could be as harsh as taking something and just throwing it. It could be a TV remote, it could be a bottle, it could be a glass, it could be a geometry box, it could be even tearing the book, or it could be even there are cases who have come to me where the parents have got hurt because of this, just because the child is not able to control. They do not rationally think before acting. They don't have that patience. They don't have that emotional resilience. So is it a disadvantage? No, it is not. The point is the child doesn't know how to do this. Normally, children see elders and they pick it up, but these children are not able to understand how elders are doing this. So when you put a framework for them, when you give them a venting out method, how do I vent out my frustration or irritation, or how do I control my energy and put it into focus? That is the framework that will help these children. And this is why it is so very important that in the formative years, within the 3 years or 3 to 5 years, we can train the children in these areas. When it comes to emotions, these children are especially on the extremes. Either they become very aggressive or they become social silos. They go into a depressive mode. They seclude themselves, they lock the room, they lock up themselves in their own world. They don't mingle, or their emotions can carry on for a duration. But there will also be very immediate fluctuations or emotional swings. This is something that a pattern, simply put, right? The child is able to sit and eat, and as the child is eating, something irritates this child. Could be the spice, the taste, the texture, until a minute back this child was laughing and enjoying, but all of a sudden it could probably just throw the spoon from its hand, or it could just say, I don't want this anymore, I'm not liking it, and they start throwing tantrums. This behavior is not just an emotional fluctuation, but it could also be having an underlying cause. Like they are having certain specific requirements, they are not able to, like autism. You remember the texture they don't like? Light, they are very sensitive to light, color, aroma. When they become hypersensitive, probably that is triggering them here. So, it is not necessary that the child in an ASD or autism spectrum disorder falls under everything. They may be able to manage some things, but some areas they will definitely need some help. One of the most important thing that you will always see is they are somehow motivated, persuaded to start a work, but they would never finish a work. Most of the time, we get to hear that parents say the child starts it but does not know how to finish it. No matter what we give, there is a reward system. After this, I'll give you this. After this, you're allowed to play. After finishing this, you try to do this. They are still not able to get the job accomplished. The reason, there could be many reasons behind this, but if this is a symptom that is persisting as a pattern in certain areas, or if it is affecting their major part of the life, other areas of the life, then please get an expert's opinion. They will be able to easily guide you through what steps you can take to minimize this and help the child regularize and put the things in place. So ADHD is most of the time I get to hear from parents that no matter how strict I am, the child does not listen. The child does not study. The child does not do his homeworks. So it is not about discipline. It is more about regulation. If the child can control its feelings, if the child can control its energy, if the child can control its emotions, its aggressions, it knows how to do these things. And then the logical mind starts kicking in, and the children will be able to accomplish a lot of things. The only trick here is since each child is unique, we will have to devise a mechanism that will be applicable for the child, for the family, the parenting style, and the environment in which the child is growing. This is why these methods become unique to each child. I hope you're enjoying this so far. If there is any questions, you can drop it in the comment section and I will take those questions towards the end of this session. Let's move on to the last part of it, dyslexia. I'm pretty sure most of you would have heard of this word called dyslexia. The dyslexia is mostly related to learning, studies, languages, reading, writing, comprehending. Dyslexia means the child is having a different kind of a strength than a normal child, and the child is not able to pick up some of the areas which a normal child can easily pick up without any guidance or with minimal guidance. This is the only difference. So, dyslexia, if identified at a very early stage, definitely the child can grow as a non neurodivergent or a normal child. I put certain symptoms here. These symptoms, if you observe, is good enough to consult an expert. And the expert who will actually diagnose this will be guiding you and training you on the methods that has to be taught to the child so that you change your world and the child's world. So the relation between these two and the communication that happens between these two worlds will be seamless. See, she sells seashells on the seashore. This is something rhyming. We, or the normal students, with a little bit of practice, we can get a hold on this. But for these children, it's a total chaos. When rhymes come, the words keep rhyming. Mat, bat, cat, rat, dad, bad. These rhyming words are so very confusing for them that they get jumbled up. If you see this as a pattern, then please try to help the child in a slower pace. If the child is able to pick it up, well and good. In spite of those things, it is not, then there are methods in place that will help the child overcome this. And this is where an expert comes into picture who can guide you those methods. They mix up letters or words. Now, letters like simple small letter B and small letter D, they can get confused. Small letter P, small letter Q, they can get confused. 6 and 9, they can get confused. They would reverse this. In place of B, they can write D. In place of P, they can write Q. In place of 6, they can write 9. So these are some things when it comes to letters. Now, words, there are two things that happens in words. Either they struggle to understand the spelling and pronounce the word, or there is something called a generalization that happens. Like, for example, if we take matter and mother, these are two words. Suppose the child has remembered mother, the word it recognizes M-O-T-H-E-R, mother. The moment the word starts with M, it would not even bother to read what is next as M-A-T-T-E-R. It just replaces that with mother. This is generalization. So they substitute the words that they know and they consider that as normal. They don't think that the word is different. So if you find such things when the child is reading a paragraph or a short sentence that is happening, then please pay attention, stop it, ask it to read again, ask it to make those phonemes or sounds of those alphabets, read those words, and if it is still not able to read, then it is a symptom to be consulted. Most of the time, dyslexic children try to avoid reading or writing. The excuses can be their hands pain, they are not able to read, they ask you to read and explain. In spite of repeatedly reading the words, they hesitate to pronounce the words. After doing a lot of rot method or any other method, when you come back to that word, they have already forgotten that word. And after reading a simple sentence, they cannot comprehend the meaning of that sentence. So, with these symptoms, what happens is children do not really like to read or to write. So, they would find every excuse on the earth to avoid reading or writing. I'll do it later. I'll play for 10 minutes and come. My hand is paining. My head is paining. I don't want you explain it to me. I will tell you this, but I cannot write this. These are all certain symptoms that you can see. They forget sequences. This is another thing. Sequences just not about days and numbers, like days of a week, months of an year, numbers from 1 to 10. What comes after 10? What comes after 20? They could jumble it. Multiplication tables. They could even not be able to follow a sequence of instructions. If you give them two or three different kinds of instruction, one after the other, do this, and after that, do this, they probably would even jumble it up. So if they're not able to do that, then you have to slow down, explain it, ask them to check at every stage and then do it. If they're still not able to do it, then yes, it is definitely a symptom. Better to get it consulted once. In spite of your persistent effort, if the child is taking a longer time to learn the alphabets, the way it is pronounced, the sound that it makes, the way it is used in constructing a word, and these words have meanings. When these words have meanings, come together, they form a sentence. The earlier stage itself to catch that is when the child is not able to recognize an alphabet or write an alphabet. There could be a couple of instances where one or two alphabets probably the child hasn't picked up or it is getting confused. That is fine. Not need not worry about it. You can try to do it repeatedly and see if the child is able to follow that and get it. But if it is not able to still do that, or if it is jumbling up a lot of things, and especially when it is used in relation with a word, then definitely it is something that you need to be concerned about. Having said that, is dyslexia about intelligence? Most of the time, the question that comes to me from the parents who come for consulting is, will my child become normal? Your child is normal. It's only that the child is learning things differently. Did you know that dyslexic children have a photographic memory? This is something they haven't checked. If you understand this, in the dyslexic method, we use more of images to teach them. We use sequences in the form of images to teach them. So, it is not that the child is less intelligent or less capable. It's just that the child is not following the normal path what the world is following or normally any average student follows. It is just following a different method. And if we identify this and give it that different method, why will it not be able to cope up? It will definitely be able to compete with this world and be one among this in this world. So do not take that as a negative, but it is more that we have to learn something different to teach the child in a different way. With this, when should parents really start paying attention? This is a very important point, right? So having said this, I said there's a pattern. Okay, do I need to really wait for 1 month, 2 month, 3 month? Which age should I consult or anything? Try to focus on these things. When these concerns or the patterns that you're watching are lasting for a few months, maybe 1 month, 2 months, even if it's 2 months, I would say get a consultation. Somewhere something is wrong and we can fix it earlier. If this is affecting the daily life, like I said, if the child is secluded and likes to be in its own world, that is fine as long as the child is doing other things. But if the child, this loneliness and secludedness of the child is affecting every other part like studies, food, lifestyle, going out, to the park or going out with the family for an outing or to the mall or to the shop or a theater or a restaurant, all these things are getting affected, then it is something that you need to be concerned about. The child seems to be getting into a frustrated state. Initially, you would not see this, the child is coping up, but over a period of time, the frustration, the aggression, or the depression is building up. If the child's behavior patterns are differing over a period of time, then before it goes to the peak or before it becomes a permanent or a stronger behavior, it is always good to get it consulted. If teachers or anyone else, generally we put students in the school or for coaching or for tuitions, if anyone else in this kind of a setup is observing the same symptoms, that means it is becoming a pattern and it is becoming a behavior. Now it is time to really start addressing that. Simply said, the earlier we help, the easier they can fit in, they can adapt, and they can grow. With this, we come to the end. If there are any questions, Please feel free to comment in the comment section. I will address them. If not, you always have my WhatsApp number and you're in the group. Definitely feel free to talk to me, catch up with me at any point in time. And if you like this video, please share and subscribe. Do leave your comments so that it motivates me and encourages me to bring a lot more sessions like this. Feel free to share this to your family or friends or anyone who would want to learn or get in touch to learn more about this. Looks like there is not any questions at this moment. So you have my WhatsApp number and you're a part of the group member. So always please feel free to talk to me, get in touch with me in case you need any kind of a clarity or information. Until then, take care. Bye bye. See you next week with another interesting topic and an informative session. See you. Bye bye.